Thank you, Steve. So we've gone through and covered an enormous number of digestive ailments and diseases, and we're going to move on and talk to you a little bit about inflammatory bowel disease. So I do have some also disclosures. I'm president of the foundation that's sponsoring this evening, and I've also received research funding and consultant from a number of the companies that make medications to treat this disease. So let's just talk about what these diseases are and what they're not. So these are diseases where the lining of your intestine is inflamed and wears away. You can think of your intestine as being lined like something like your skin. It's smooth, it's shiny, it's protective. If you wore away your skin, or if you held your hand over a candle and burnt your skin, it would be painful and that skin would be perhaps bleeding, raw. Something similar happens in inflammatory bowel disease. In ulcerative colitis, this mucosal ulceration, or this wearing away of the lining of the intestine, occurs in the large intestine only, in the colon only. And so we've labeled that as ulcerative colitis. Crohn's disease is slightly different, and I've showed you a picture there. Not only does the lining of the intestine wear away, and that's where it's similar to ulcerative colitis, but it can wear away in different parts of the intestine, anywhere from your mouth all the way down to your bum. And so Crohn's disease is different than ulcerative colitis, really because of that, because of its locations. Crohn's disease also has something different. Ulcerative colitis only involves that lining of the intestine, but Crohn's disease can involve the entire thickness of the intestine. And that becomes important in some of the types of symptoms that you get, and we'll discuss that in a little bit. Now, the word colitis has been applied to many things. In our mind, in inflammatory bowel disease, when we talk about colitis, we're talking about inflammation in the large intestine. There are other diseases, other disorders where the word colitis has been associated, but these are not inflammatory bowel disease. These are not ulcerative colitis. These are not Crohn's disease. Something called microscopic colitis is not inflammatory bowel disease. Something called diverticular colitis is not inflammatory bowel disease. Spastic colitis, and you've heard about irritable bowel syndrome. That's not inflammatory bowel disease. So patients come to us and they say, I have colitis, and I have spastic colitis. How can you treat that? We need to be clear that inflammatory bowel disease is quite different. It's ulcerative colitis, it's Crohn's disease, and it's not those others. I've drawn you a picture here of the large intestine, and this is ulcerative colitis. It affects the colon only. It's the lining, the mucosa is inflamed. And in that colored diagram, you see there's yellow, which would be the rectum, and then there's the green, which is the left side of the colon, and that red, which is the transverse part of the colon, and the right side of the colon. Ulcerative colitis is an interesting disease because it begins low down. It begins in that yellow part in the rectum, and it extends upward to involve the green part and sometimes the red part. And it doesn't necessarily need to have the yellow part, the green part, and the red part. It can stop at the yellow part, and then you have something called proctitis. It can be the yellow and the green, and then you have something called left-sided colitis, or it can be all of those yellow, green, and red sections, and we call that pancolitis. And that's important for us and for you because the treatments can be different. The types of drugs we'd use, how we would deliver them, might be different. So your doctor will want to see you, identify where your colitis is so that he or she can best direct your therapy. Again, Crohn's disease. If you have Crohn's disease, your doctor is going to want to do a number of tests on you to determine where that Crohn's disease is. They may do an upper endoscopy looking down your throat with a little video camera. They may do a colonoscopy looking up your bum with a little video camera. They may do a CAT scan or an MRI scan. They need to know where the Crohn's disease is. And I've drawn little diagrams there of where it might occur. I said it can occur from mouth to anus, but those diagrams show you how, unlike ulcerative colitis, where ulcerative colitis begins in that rectum and travels up the left side and then down, Crohn's disease skips around. And you can see by those red markings on those pictures of your intestines that Crohn's disease occurs in different spots in different people. Important for your doctor and you to know that because your treatment's going to be different. The types of drugs they use might be different. How they deliver those drugs will be different. So inflammatory bowel disease is a disease that affects your life, but it doesn't have to limit your life. For the most part, your symptoms are pain, cramps, diarrhea, and sometimes bloody diarrhea. Those types of symptoms make it difficult to go to school. Having diarrhea and trying to go to school is difficult. Having diarrhea and pain and trying to go to work is difficult. And so it's important that you know that there are treatments to manage this disease. We cannot cure this disease, but we can manage it. And these are pictures of people who have inflammatory bowel disease, from Dwight Eisenhower, President of the United States, to NHL athletes, to Olympians. And so all of these people were able to continue their job, manage their lives with good control of their inflammatory bowel disease. A couple of special things to know. Crohn's disease occurs in different parts of the intestine, always comes back. If you cut it out, join your intestine back together, it'll come back. You can never remove it completely. So it's not a solution. Surgery is not necessarily a solution to remove this Crohn's disease and cure you, because it will always come back. Ulcerative colitis, if you take out your large intestine, interestingly, ulcerative colitis doesn't come back, but then you also don't have a colon. So while we use surgery as a treatment for these diseases in certain circumstances, surgery is not necessarily a cure. Another topic. This is a picture of the world. Yellow indicates where we have inflammatory bowel disease. Blue indicates where we don't. What do you see in this picture? It's developed countries. How interesting that this disease occurs in North America, whereas we don't have it in South America to the same degree. And it's not that the people in South America are much different. It's not that their genetics is any different. It just doesn't occur there yet. So something in our developed countries, something in our environment, something perhaps in our diet is driving this inflammatory bowel disease. And this is a little graph from 1950 up into 2000, and you can see there's a steady increase in both Crohn's disease and in ulcerative colitis. So something in our environment, something is driving this disease to occur more frequently in us and more frequently in developed countries. And interestingly, Canada has one of the highest rates of inflammatory bowel disease in the world. Canada, Finland, Denmark. This is an important slide. When does this occur? Most diseases we think about occurring in old people, it'll never occur in us, right? We're all too young. It'll occur in somebody older. Your grandmother gets a disease. You never get a disease. Not inflammatory bowel disease. These are people in the prime of their life, 15 to 25, trying to go to school, get a job, buy a house, have a family, and they have pain, cramps, and diarrhea and soil their underwear. So it has a large impact. So I'm going to stop there, and we'll have a chance to answer some questions later on about this disease. Thank you very much.